Good evening, I'm Janikra, and today I just wanted to speak to you and give you an informative information about the importance of healthcare. My main point today is to give the history of healthcare, to give good points and reasons why healthcare is important, and the effects of healthcare worldwide. The history of healthcare starts with World War One. Healthcare became more pressing for matters within the hospital and physicians because they started to charge more. So with being able to charge more, they started a program of prepayment. The prepayment services turned into the pre-service development of Blue Cross Blue Shield, of the pre-service for health insurance, which is Blue Cross Blue Shield today, one of the most leading health insurance companies around. President Truman was the first president to actually bring about healthcare as a government plan, to where the government would pay for it. It did not come into play until 1970, when Lyndon Johnson actually signed it into law. My second point with the expansion and the importance of healthcare is having comprehensive quality healthcare services for promoting and maintaining and managing diseases, unnecessary disabilities, and premature death. According to the CDC, health disease, cancer, respiratory disease, stroke, and unintentional injury is the leading cause of death. The World Health Organization, they promote and state that better health is central to human happiness and well-being. Also know that there are three types of health insurance and health care. You have your primary, your secondary, and your territory health care services and needs. They're all based on illnesses and needs, and also family structure. Next, I just want to point that healthcare worldwide, as we can see today, it clearly affects us. Diseases and viruses, they do travel from one continent to the next, one city to the next, one person to the next. Doctors and nurses, they all have to lean on each other. They have to be universal when it comes to the healthcare system. You want to be able to have the same practices here in America that they would have in Africa or China or Europe or any of those other countries, so we're all could be on the same accord when we're fighting these diseases and viruses and such things like that. According to the Texas Department of Health and Human Services, at this point in time, with COVID, the COVID-19, we have 5,330 deaths. 5,330 cases, but we have 90 deaths. This is the impact, and it's important for the worldwide in healthcare services to be uniform and be universal, and to promote good healthcare and good healthcare systems. In closing, I would just like to remind you the essential healthcare benefits such as ambulance services, emergency services, hospitals, maternity and newborns, mental health, substance abuses, and prescription drugs. Healthcare is important, healthcare is evolving, and healthcare along with science should be given to all, no matter race, culture, or financial statuses.